So I was just about to do my own little stability workout that I do every once in a while when I feel like my pelvis is out of alignment, my SI joint kind of starts to hurt. So if you consistently get a little bit of SI joint pain, one of those little dimple areas on either side, a great little routine, tiny little routine, but with the requirement of a little bit of basic core strength and stability. So if you're really flared up or if you're in a lot of pain, don't do this. But if you like consistently kind of fall out of place and have some hypermobility issues, then this could be a good routine for you. If any of it hurts, don't do it. So it's all about IAP, maintaining your IAP. So intra abdominal pressure is on, engaged. Super tight here. Support your head. And away we go. So I like to just go right into 90-90 position and with hip flexion. So because I'm pretty unstable, I easily knock myself out of alignment. I start with just one leg at a time. And I really have to focus, engage. The minute I don't, I feel pain. So you're going to try to do 20 of these on each leg, and remember to engage that leg that's stabilizing you. You're stabilizing here, you're stabilizing here when you're kicking that right leg. Switch legs, so now you're stabilizing, really hold on with that hip flexor in here. Keep the rest of the core really tight, keep your back flat. And try not to tense up in your neck. Same thing, and then I like to go into alternating. So you're going to do 15 to 20 on each leg. Good, so now, clamshell. And you can do this with or without resistance. You can make this as hard as you want. Sometimes you don't even need any resistance if you're just going to hold it for a nice long isometric and maintain that IAP. There we go. So I'm engaged here. This sucker is on. I'm not letting myself sway anywhere. My back's totally flat. I'm in line from my heels to my butt to my head. And my leg is swung open. You can see my heel is pressing into my bottom foot. You can hold up to a minute. Something to look for is hip hiking here. You want to make sure that you're not up here. You'll start to get some back pain right behind this area. That's where your QL is going to overwork. You're going to feel it in your back. So kind of reach this hip away from you and then reach and then engage and lift. Don't let that hip come up. It's helpful, I think, to press down with the heel. That helps to keep the glute engaged. Do a different view. So a lot of times instead of holding for a certain amount of time or even reps, I like to just count my breaths, because I know that's what I need to be doing, and keeps you in check and keeps you breathing, breathing the right way. All right, last one, bridges. So as you've seen, these are like super basic exercises, but when done with IAP, they're a little more difficult, and they're targeting all the right areas. So bridges with your feet together. Band is up over my knees, feet apart. IAP on. Lift. I'm gonna bring my knees a little closer together, and then you're just gonna alternate pulling. And again, same thing. If you're really susceptible to like pulling yourself out of alignment, if you're really unstable, start with just one leg at a time. Really get that stability so you don't have to fight to start over every single rep. So just do like 10, 10. Try to do 3 sets on each leg, or try to do 10 and 10 and then go into alternating, which is what I like to do. It's like you're turning on all the right muscles, and then you can step up and make it a little more challenging for your muscles. Big thing with this is making sure your hips stay aligned, that one hip isn't dropping down or your back isn't twisting as you move. And switch legs. As you notice, I just went with the breath. I just fall out of counting and I just end up counting my own breaths, which is like totally fine. It keeps you accountable of your breathing. The big thing when you're doing this is that you don't want to let this other leg get pulled while you're opening up. One leg should always maintain stability while the other one opens up, and then you can make it harder by alternating. You just have to think about it a little bit more. Just be very cognizant and aware of you're really pulling back here. And if you're not paying attention to what this is doing, then you're just gonna start using your back and all the wrong muscles, and you're gonna pull yourself out of alignment. So don't do it. Stay aware, stay engaged. And P.S., you should be feeling this in your glutes. Nice. Here's one more bridge. Double leg, feet are apart now. I'm just in alignment. Hips, knees, feet are all in alignment, stacked. And you don't have to have a band around your knees, but if you want it harder, then keep the band. You're gonna lift. A lot of people just go straight into marching with this, and I don't like to because I see so many people just start twisting back and forth. So stick with one leg until you feel super solid, and this is too easy. And these hips should not be falling down. They should stay straight up. But if you need to, give yourself a little assistance in the beginning. But then let your core do everything. Cool. Okay, so my SI joint doesn't hurt anymore, and I'm nice and stable, and I hope you are too.